Good day, Virgin Islands community. I am Dr. Michelle Davis, your Health Commissioner. Our mission here at the Department of Health is to reduce health risks, increase access to quality health care, and influence health standards in the territory. A focus of the Department of Health is to promote healthy habits that would ultimately prevent and control diseases in the community, and to achieve health equity through public health transformation. As such, the Department of Health is embarking on a tobacco-free campaign from July 28th to September 28th. The tobacco-free campaign is in line with the Centers for Disease Control and Prevention, the CDC, and the nation's vision to create a world free from tobacco-related deaths and disease. Our goals for this campaign are to 1. Discourage tobacco use among our youth and young adults. 2. Promote quitting among users. 3. Eliminate exposure to secondhand smoke. And 4. Increase awareness to the dangers of tobacco use and everyone's right to breathe fresh air, as noted in the Virgin Islands Code Act 7171, which delineates the VI Virgin Islands Smoke-Free Act. Being that tobacco is the leading cause of preventable disease, disability, and death in the United States, Act 7171 was passed in 2010 to promote a smoke-free environment. The smoke-free law requires businesses to post no smoking signs in their establishments in which smoking is prohibited within 20 feet of any establishment's entrance, exit, window, ventilation system, or other openings of any public place and place of employment. The law also speaks to no smoking within 20 feet of all outdoor public transportation stations, outdoor service or waiting lines, for example, food vans. Smoking, though, is allowed in private homes, private clubs, retail tobacco stores, for example. Our mission, once again, is to protect the public's health, so you can look forward to hearing radio ads, seeing billboards, flyers, TV ads, social media posts regarding the tobacco campaign. Now, my Director of Chronic Diseases, Kathleen Arnold Lewis, will let you know more about the smoke-free law, the dangers of secondhand smoking, and what you can expect during the tobacco campaign.
Tobacco is the leading cause of preventable death, disease, and disability in our nation. Smoking in general is not beneficial to our bodies. What makes tobacco products so dangerous? Chemicals are found at every stage of the tobacco growing process, to growing plant, to the manufacturing of the product for sale in the form of cigars, cigarettes, cigarillos, tobacco leaves, chewing tobacco, snuff, and etc. The burning of tobacco releases over 4,000 chemicals. Nicotine, one of the most talked about chemicals in tobacco, naturally exists in the tobacco plant. It is known that tobacco may lead to addiction in the tobacco user. Nicotine enters the body when smoked, inhaled, or chewed, and eventually ends up in the bloodstream. In addition to nicotine, over 4,000 chemicals are released from the smoke, to include acetone, which is found in nail polish remover, butane, found in lighter fluid, ammonia, found in our household cleaner, arsenic, found in rat poisoning, and many, many more. We don't want these chemicals entering into our bloodstream. Once they enter our bloodstream, they enter into all the areas of our body. And this can lead to damage to our brain and other organs, to include your heart, to include your lungs. And this also leads to increase in blood pressure, increase in heart rate, and affects the nervous system as well. Chronic diseases are exacerbated by the use of tobacco. Diabetes, heart disease, and strokes all have relations to the use of tobacco. In our community, we use Fanta, which is the tobacco leaf. I want it to be known that Fanta leaves are tobacco leaves. The mixing of tobacco or tobacco leaves with any other product, such as marijuana, is likely to produce similar harmful effects on the body. We need to be aware. According to our law, smoking is prohibited in public areas. Public areas include restaurants and bars, hotels and resorts, public schools, parochial schools, private schools, colleges and universities, laundromats, bus stops, beaches, parks, playgrounds, to just name a few areas. The most important thing about this launch that we're about to do is not the launch itself, but it's part of a bigger picture where we're making a movement to educate and improve the health of the people of the territory. We are making sure that persons are aware of the dangers of tobacco smoke, tobacco use, and want them to refrain from the use of tobacco. We are trying to protect our children and any persons who do not smoke from the harmful effects of tobacco, and this is very critical to our future. If you use tobacco, make changes to reduce the amount of tobacco that you use, and make moves to quit smoking or using tobacco. If you do not smoke or use tobacco, do not start. We want you to be smoke-free. We want a territory that is smoke-free. If you want to quit smoking, you can call the 1-800-QUIT-NOW line. And also, there's a complaint line for the community to call in if there's a violation of the law. That number is 712-6230. Here we have a demonstration of some of the posters you'll be seeing in the territory, and you'll see this throughout the island of St. Croix, St. Thomas, and St. John. And again, we emphasize and we want to educate our community in being smoke-free for a healthier Virgin Islands.
And once again, we have a quit line, 1-800-QUIT-NOW. We also have a complaint line, which is 712-6230.